Hello everyone. Welcome back to Professional Career Update. I am Poonam Raghuvanshi. In today's session, we are going to discuss one of the most frequently asked interview question in clinical SAS. So question is, how do you identify a serious adverse event? So that is SAE. S stand for serious, adverse and E event. So serious adverse event, which is available in AE domain. So first, let's understand few important point in CDISC. SDTM is there. So SDTM mean study data tabulation model. There is a no separate domain called SAE. All adverse event, whether they are serious or non-serious, are stored in AE domain. That is the adverse event domain. The only difference is the serious adverse event are identified using specific seriousness variable available within the AE dataset. So what is serious adverse event? Now let's understand the definition of SAE. So serious adverse event is not determined by how severe the symptoms are. Instead, it is determined by regulatory seriousness criteria defining clinical trial guideline. So you have to remember one thing, severity that tell us how intense the adverse event is, like it is mild, moderate or severe. But seriousness tells us whether the adverse event has important medical or regulatory consequences. The main variable used in AESER in AE domain. So AESER, so SER stands for like a serious adverse event. AE means this is like a adverse event domain. So this is domain abbreviation and SER means variable, serious adverse event. In real time, if this AESER created a flag like yes and no, if that is Y, it means adverse event is serious. If N, it means that adverse event is non-serious. However, AESE are not assigned randomly. It become by when at least one seriousness criteria is met. If AESER is by, then other variable also created in AE domain. So someone is asking if AESER is by, then which variable will be created? So in that case, you have to remember AESDTH, that result of death. If the event caused subject death, then it will be created by or N. AES life threatening subject was at immediate risk of death. So that if it is true, that in that case, that variable created as a by, otherwise N. Is there any hospitalization? If yes, then variable will be created AESHOPS. If any disability in incapability, so in that case, that AESDISAB variable will be created. Is there any caused congenital anomaly or birth defect? In that cases, that variable created will be AESCONG. Other variable, that AESMIE, medically important event, considered medical important even if it is doesn't meet the other criteria. If it is true, then that variable will be created as a by or N. So for these variable, we are creating the flag. Yes means by and N means no. So here you have to remember one important point. A severe adverse event is not necessarily a serious adverse event. Seriousness is determined by regulatory criteria, not by symptom intensity.